Now, to understand the concern at this point, we have a guest joining us on the broadcast, Dr. Rahul Pandit, who is a member of the National COVID Task Force. He's also a member of the Maharashtra COVID Task Force and Director of Critical Care at Fortis Hospitals in Mumbai. So, welcome to the discussion. Now, with the rising cases, there is a concern of whether we're actually witnessing a fourth wave. Aditya Thackeray is saying that the state could be seeing a fourth wave, but the concern going well beyond Maharashtra as well. Do you think Maharashtra is in a fourth wave, or perhaps the country at large could be seeing one very soon?
Good morning. So there is no doubt that some of the districts in Maharashtra have been seeing a silent rise in the cases. And while the reason I'm using this word silent is because majority of the patients have been actually asymptomatic or mildly symptomatic. Now, whether to actually call that as a wave or not, I think it's just the play of words. We could be basically saying that the cases are rising and we need to control these cases as quickly as possible. And that is how I would like to put it across. To call it as a wave or not is, I think, a game of numbers. Somebody might say that the current numbers are actually a wave. Somebody might say we might want to wait for some more time to see whether it is rising or not. Right. I think the reality is that some of the districts are showing a rise and we should quickly act upon that and try to control these numbers.
Right. So, as you said, some of the districts are witnessing a rise, and we've seen from our experience with the previous waves, it always begins from one or two states, from Maharashtra or Kerala. So, do you think other states could also follow, and the guard in other states also needs to be more stricter at this point, considering this as a sign?
So, in the last 2 years, we've always consistently sent one message across that COVID has not gone yet. Yes, the numbers of cases had gone down considerably, and people need to still be vigilant and keep a lookout on the rising in cases. So, once we see a cluster or a particular district showing a rise in cases, it is up to us to go back to our basics, increase the testing there. Make sure that people are wearing a mask at least in the indoor areas where the air circulation is poor, because that has got good data to show that in indoor with poor air circulation, offices, auditoriums, those are the places where we should be wearing a mask definitely, and it should be becoming as a voluntary health habit. I don't even want to talk about whether it should be made compulsory or not, because how to implement that is a government's decision. But from a doctor's point of view, I can say that we should make it as a health habit. Just like when we cross a road, we look on our right and left and then we cross our road. We should be careful of our own health and wear a mask when we are indoors, when the air circulation is in question. Can same thing be said about outdoors? Well, in open air ventilated places, perhaps the transmission is not that high. So the same data does not exist for outdoor places where the air circulation is very good. But even in outdoor congregations of crowds, it would be worthwhile to wear a mask, because that's where the people would be in the close proximity. And cities like Mumbai or Delhi or Chennai, which are metropolitan cities where the density of population is high, we should be wearing a mask whenever we are in a congregated place.
Right. So, Dr. Pandit, also, as you talked about the government taking measures and people making it a habit, but to control this habit, we've seen that there have been large gatherings recently, and those could be one of the reasons increasing the worry of the spread. So, do you think the government should now bring back some of those measures that were earlier put in place to control the curve, possibly limiting the gatherings and putting up mask mandates again?
Again, I think one of the things which has been repeatedly talked about by us is that we have to live with COVID for some more time. Nobody can say whether it's going to be 1 year, 2 years. We have to accept that COVID is within us and we have to continue having our normal day-to-day life with the due precautions. So all of these gatherings, as long as COVID appropriate behavior and COVID appropriate protocols are being followed, I think we should not be saying that we should put curb on this or that. We should continue with our normal day-to-day activity. Yes, don't go out of the way and out of the board to try and sort of have a crowd which would not be necessary. But whatever is necessary, whatever is important, I think that those activities should continue.
Right. So normal activities should continue, but of course with the necessary precautions. But to also understand this surge, Doctor, what do you think triggered this surge now? We've been without masks for months now, ever since Omicron wave had passed us since the month of January. We've been without masks. So why do you think this recent surge has sparked now?
So virus obviously has got a cycle of its own. It sort of has a lull period of few months and then it probably comes back up again. And what we are seeing is that the genome sequencing, which has been done by the government of India as well as by the government of Maharashtra, is thankfully showing us only the Omicron and its sublineages like BA1, BA2, and recently we found some BA4, BA5 as well. So as long as we don't have a new variant, and we have just lineage, the different lineages of the same variant right now, I think we know that these cases are most likely going to be mild. But what we need to do is we need to keep a very close eye on the genome sequencing. I think that's going to be a center pillar for us, because as soon as we identify that we have a different species or a different variant or a different type of symptoms coming across, that's where we need to be extra vigilant as doctors. We need to bring that to the quick notice, and we need to then take up very strict precautions. So those areas where we have a different variant which might be seen emerging, which could be different from the current variant which is in circulation.
Right. Dr. Pandit, you mentioned variants, which are, of course, a concern. So do you think, just to make this clear, do you think the current surge is being completely driven by Omicron again, and all the symptoms that we're seeing for now are mild?
So at the moment, hospitalizations are very, very low. Hardly any people are there in the hospital as well as in the ICUs or on the oxygen beds. And we have seen a similar trend when the Omicron wave was there in January. And whatever genome sequencing reports we are getting, it is showing Omicron and its variants only. So right now, there is no indication to say that we have a different variant. Of course, a few cases are there which are of Kappa and other variants which were there before, but they are very, they're in single digits probably. Most of the variants most of the cases which are there are Omicron and its variants only.
Right. So that is a relief that for now we're at least not seeing a new variant. Thank you so much, Dr. Pandit, for joining us on this conversation and getting us more clarity on this recent surge.
Thank you.